Well, hello everyone. Welcome to the June 30th edition of the weekly COVID-19 situation report. This is Brittany Cadence, the Communications Manager for Peterborough Public Health. Welcome you here the day before Canada Day as we learn the latest on COVID, and thanks to all of our elected officials who are joining us here today. And thank you to our media partners who have done such a great job through this pandemic, helping us get the word out. So today I think is an especially important day to take a moment and recognize this land. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. All right, so I'd now like to invite our Board of Health Chair and Mayor of Selwyn Township, Andy Mitchell, to start us off. Please go ahead, Andy.
Thank you, Brittany. Early this morning, the province entered Step 2 of its reopening plan. Similar to Step 1, the relaxed regulations are largely centered on lower risk outdoor activities. This is good news, and when combined with the continued progress on the vaccine rollout, represents a significant step towards normalcy. There are many people, groups, and organizations that have contributed in getting us here. I would like to thank everyone and to highlight a few. I will start with those involved in vaccine development and deployment. I am deeply appreciative of the scientists who developed the vaccine, the federal government who procured multiple vaccines from multiple sources, the provincial government for organizing deployment, public health and others for administering the shots, and of course, everyone who has rolled up their sleeve and has been vaccinated. I would also like to recognize the people of Peterborough, city and county. Your willingness to follow public health measures has limited the spread of COVID-19 and has allowed us to reduce the number of cases in our area. I also want to recognize our small business community. Many have borne the brunt of the pandemic as they diligently adhered to lockdown restrictions. Their loss of opportunity and treasure has contributed to our ability to control the pandemic, and we will need to work towards their continued recovery. In addition, I want to recognize our student community. This has been a difficult and frustrating year with so many important milestones missed and experiences foregone. The past 17 months will be a defining moment in their young lives, and we need to do everything in our power to ensure that they have an opportunity to regain what was lost. Our progress has been the result of a community effort. Healthcare workers who cared for the sick, essential workers who continue to serve our needs, educators and caregivers who continue to care for our children. We should be proud of the entire community and its effort. Stay safe, be well, and in all things, be kind.
Wonderful. Thank you very much, Mayor Mitchell. All right, so now to lead us through these next few slides, let's hear from our Medical Officer of Health, Dr. Rosanna Salvatierra. Please go ahead, Dr. Salvatierra.
Thank you, Brittany. So I'd like to share with you our current case count. As of 4 p.m. yesterday, we had 11 cases active in the community. We did report 4 new cases yesterday afternoon after a welcomed few days with no new cases. The number of close contacts has dropped, as you can see, to 42. Sadly, we also reported yesterday another death in the community due to COVID-19, bringing our total now to 22. We are receiving confirmation of more cases of Delta variant circulating in our community. Currently, more than half of our active cases are infected with the Delta variant. And from the data that we've looked at, we believe that the Delta variant is now the dominant strain circulating here in Peterborough. Next slide, please, Brittany. Here you'll see our cases reported by the week, and you can see that the weekly cases continue to drop very nicely. Last week, June 21st, we saw a significant decrease with only 6 new cases reported. And as I said earlier, it's really very reassuring to have many days without any cases at all. So keep up the good work, everyone. Next slide, please. Outbreaks as well, lots of good news. We continue to report no active COVID outbreaks in our community. The last outbreaks were declared over on June the 12th, and certainly we are all hoping we can keep it this way. Next slide, please. As far as exposures, we certainly see that most of our cases are as a result of close contact, and that continues to be the leading source at about 77% of all of our cases. We'll look at our case incidence rate and our map, and you can see on the right of the slide our weekly case incidence rate for the week ending June 28th has dropped to 2.7 cases per 100,000, and this is significantly lower than the case incidence rate we reported last Thursday when we were still at 11 cases per 100,000. With this map, we are showing the number of active cases in each region in the province, and you can see that Peterborough is in a very light pink shade, and along with most of the other public health units. The areas with the darkest zones are those where the Delta variant is currently gaining a foothold, such as the region of Waterloo and in Toronto, and they remind us why we must remain vigilant. Next slide, please. So here we're showing our current vaccination data at the end of yesterday's clinics. And just to note that we have changed our denominator to align with the provincial one. And it does assign a greater population to Peterborough. So it does mean that our percentages have shrunk a bit. But nonetheless, the numbers continue to climb, and the gap between those who have received first doses and those who've received second doses is starting to narrow. Currently, over 98,000 of our local residents have received a first dose, and that works out to be almost what we're showing here, almost 76% of our local adults 18 years and older. And again, if you look at the pie charts, you can see that about 60% of our youth aged 12 to 17 have also had their first dose. Next slide, please. When we look a little closer at our second doses, 44,000 have been administered, and this means that almost 36% of our local adults and just shy of 3% of our youth 12 to 17 have received that second dose and are considered fully immunized. So as our Board of Health Chair noted off the top of today's briefing, we have now officially entered step 2 of the provincial reopening plan. While this does mean that most of us can now get a haircut and are allowed to have family visits or that the kids can go to camp, it does not yet mean that we are ready to forget about the need for physical distancing, masking, and vaccination. Step 2 must be done with caution and care as Ontario continues to experience outbreaks fueled by the Delta variant. I agree with our new Chief Medical Officer of Health, Dr. Kieran Moore, that we must be careful at this potentially fragile phase in our recovery. So what can we now do safely? The new public health measures now offer us more opportunities to get active. Outdoor fitness classes and outdoor training can resume with no limits on the number of people in an outdoor exercise class, but every person in that class must maintain a physical distance of at least 3 meters from everyone else. Team sports or games can proceed, but must be modified to avoid personal contact. Close contact sports, even outdoors, can come with risks due to the inability to keep that distance at all times while playing the sport, and also the deep breathing or forceful exhalation that's associated with exercise. So for this reason, I do recommend that you choose one team sport to play this season, and that will help keep your contacts low. Also, remember not to share your food or your water bottles or your equipment with others. Do not share rides to practices or games. It's best to ride with only your household members, or better yet, to walk or to ride your bike to get there. Please make sure that we all continue to self-screen before going. Certainly, if anyone feels the slightest bit sick, it could be COVID. Avoid tournaments. These have the potential to create large gatherings and many contacts. Tournaments are something that we can look at resuming in step 3 or beyond. And if you are an adult or a teenager helping out with a youth team, please get vaccinated. It's one of the best things you can do to help protect our younger population who's not vaccinated yet. I encourage organizers and conveners of local sports associations to consult our website, as it has been updated with the latest public health guidance. Step 2 also permits yard sales, and that now is up to with 25 people outdoors in accordance to the new social gathering limits. But please remember, physical distancing of 2 meters is still required whenever you're around others who are not from your household. And masking is always a good idea if it's challenging to keep a safe distance at all times. For our seasonal residents and those with secondary properties in the Peterborough area, we continue to encourage you to bring everything you need with you to minimize the number of stops on your way. And as we get to 2 weeks beyond our second dose, the risk of infection drops dramatically and indoor gatherings become more of an option again. However, it is still important, as I said earlier, for everyone to continue to screen daily and to stay home, not gather, but to isolate and test if ill. The Delta variant, for example, does have a higher incidence of headache as a presenting symptom, and testing is still readily available at the Northcrest site or at the hospital's assessment center. In step 2, it is permitted to host up to 5 people indoors or a maximum of 25 people outdoors. Gatherings can include non-household members, but remember, all public health measures must continue. If you're operating a boat to transport some non-household members to your cottage, for example, please remember to provide at least 2 meters of distance while boating. Crowding on boats, even though it's outdoors, is still risky. So you need to limit the numbers and spread everyone out. The other good news I'd like to share today is that the province has further eased restrictions in our long-term care. And that means that as of July 7th, residents can have outdoor visits of up to 10 people. All residents may have up to 2 general visitors and 2 caregivers for an indoor visit. The limit on the number of persons who can be designated as caregivers has been removed. Personal care services, such as hairdressing and barber services, will be able to resume, and the cohorting of residents can be relaxed during outdoor activities. Also, starting tomorrow, July 1st, the province's directive that requires long-term care homes to have a COVID-19 immunization policy comes into effect. At a minimum, the facilities policy must require staff, student placements, and volunteers to do one of 3 things: either provide proof of vaccination against COVID-19, or provide a documented medical reason for not being vaccinated, or participate in an approved educational program on the benefits of vaccination and the risks of not being vaccinated. This directive is an important measure to help keep our elders safe as possible. Given their age and underlying medical conditions, long-term care residents, even if immunized, remain at a higher risk when it comes to both the transmission of the infection, but also the severity of disease compared to the general population. Today's reopening, of course, would not be possible if it weren't for the enthusiastic uptake of vaccines, both locally and across Ontario. Yesterday, we added another 12,000 open appointments online that can be booked for our local clinics. And also, starting tomorrow, Canada Day, anyone 18 years of age or older seeking a first dose of a vaccine can walk in at the Evan Root Centre between 9 a.m. and 2 p.m. 7 days a week. For those with booked appointments, don't worry, your mRNA dose is guaranteed and your appointment time won't be impacted by the walk-ins. We've set aside additional doses for those who walk in. And remember also, it's safe to mix mRNA vaccines. So I encourage everyone 18 years of age and older who hasn't been vaccinated yet to please come on down to our clinic. Just bring your Ontario Health Card and proof of residence. So that's it for me, Brittany. I'll turn it back over to you.
Okay, thank you very much, Dr. Salvatierra, for that comprehensive update. Okay, so I believe we have MP Mary Monsef with us to bring some greetings, and then we'll follow up with County Warden Jones. So let's start with MP Monsef, and happy early Canada Day to you, Miriam.
Well, hello, Brittany, Cadence. Hello, colleagues. Bonjour, Anin, salam alaikum. I'm in my home on Mississauga territory, and so grateful for all the good news that you've shared, Dr. Salvatierra, and as always, for your wisdom and leadership, Andy Mitchell. I'll focus my remarks on vaccines, stage 2, and some reflections on Canada Day. Vaccines and their deliveries remain on the rise, with millions coming into the country every week. In July, we're expecting 18 million doses of Pfizer and Moderna. This will mean that Canada is going to have 68 million doses by the end of next month, enough to fully vaccinate 33.2 million Canadians who are 12 years old or older. Last week, the wonderful team at Public Health Canada released guidelines for life after vaccination. This is a resource aimed to help all of us make informed decisions to enjoy a safe and healthy summer. I encourage anyone interested to go to the Public Health Agency of Canada's website, where there will be more information about this. As we enter the long-awaited stage 2 of reopening today, it's important that businesses and organizations have safety and plans in place to limit the risk of exposure of staff and their customers and those who receive their services. To that end, yesterday, the Canadian Centre for Occupational Health and Safety announced that they have developed a free online course to help organizations and businesses in the country to conduct a scan, if you will, a workplace risk assessment and safety plan. This course is completely free of charge, takes about half an hour to complete. Managers, supervisors, health and safety committee members will learn the work and personal factors to consider when assessing and preventing risk exposure, reviewing a safety plan to ensure it is effective, and keeping up with COVID guidelines as they continue to evolve. On Canada Day, the somber tone this year, and I think even the gray skies and the rain offer us all an opportunity to mourn and to reflect. And I started doing this as when Rotary invited me to come talk to them about what it means to be a Canadian years ago before politics. And so it's become a bit of a tradition. I reflect on what it means to be a Canadian and the privileges, that responsibilities that come with being on Canadian soil, and on where Canada and Canadians are headed. I'll be honoring Canadians who came together in shared sacrifice, who looked out for their neighbors, either in their professional capacities or as volunteers. And I'll be reflecting on the lessons of COVID. You know, in addition to make sure you get the second dose and let's prevent the spread of the variant, we've got some work ahead of us. What has COVID taught us? That women like those on this call have been carrying the brunt of the fight against COVID and so much more pre-COVID. We've learned that health is truly wealth, and an ounce of prevention is worth a pound of cure. That care and care workers are core to our economy. And we've told people to stay home, but not everyone has a place to call home, and not every home is a safe home. We've learned how important haircuts are. And I hope that we're all nicer to our hairstylist professionals moving forward, and that we don't give ourselves as hard of a time on our bad hair days. And all of this is happening within the context of multiple reckonings and wake-up calls post-COVID. We've had time to ourselves with our thoughts, to reflect on our values. We haven't been rushing from thing to thing, and we're facing a history of colonialism and racism that Indigenous leaders and so many before have been advocating and asking us to see and to accept. It takes courage to face these truths. Whether it's Me Too, Black Lives Matter, Every Child Matters, the hate that Asians in Canada, Muslims, Jewish folks are experiencing, the homophobia, misogyny, ableism, and ageism that has existed has only been magnified and intensified by COVID. So once we put this pandemic behind us, that's the work ahead. This Canada Day, I'll be wearing orange. I'll be holding my loved ones, especially the little ones, extra close. Thinking about all the times that we couldn't hug them this past year, thinking about all the little kids ripped from the arms of their parents and loved ones and taken to a scary place where the essence of who they were was being wiped out. Thinking about those who never came home and those who did come home broken. And they're with us as elders now with wisdom to teach us. My family will be talking about the Truth and Reconciliation Commission's Volume 4 report and what calls to actions 71 to 76 mean. And we will be grateful Canadians, thankful to all of you who have kept us safe in these difficult times, and renewing our resolve as settlers to step up as good allies and to make sure that the future of this country, particularly for Indigenous kids, is bright, safe, and filled with opportunity.
Thank you very much, Miriam. indeed lots to reflect on as we move into Canada Day tomorrow. Okay, let's hear from County Warden Jones, and then I'd like to invite Mayor Therrien, if she's able to share some remarks. Please go ahead, Warden Jones.
Well, thank you very much. That's a pretty hard act to follow, and I certainly echo all those comments. It's a very strange time as we approach Canada Day. I suppose we all need to maybe just take the day to reflect and look in the mirror and just do a lot of thinking. I haven't got a lot to say other than we continue to be proud of our staff here at Peterborough County, the frontline people, the paramedics, our public works crew. Everyone's doing a huge job, and they continue to do it. And I just want to, I guess, emphasize the thoughts of Rosanna for all of us just to still be careful. We will get out of this, and we're almost there. Anyway, on behalf of Peterborough County, I want to wish everyone a very special summer holiday weekend. Have a good time, but let's not get carried away so that we can have a good time next week as well. So thank you, everybody, and just keep up the great work because we're all in this together. Thanks.
Thank you very much, Warden Jones. And I believe Mayor Therrien had to jump off our call. So with that, we will move on to our media questions. So I think I would like to start with Paul Rellinger today, if you've got some questions for Dr. Salvaterra. And we do have some representatives from our enforcement partners as well. So thank you to our OPP and Peterborough Police spokespeople. So go ahead, Paul.
Thanks so much, Brittany. Dr. Salvaterra, good afternoon.
Hello.
I just, the numbers, as you're well aware, have been trending in the right direction lately. And the stage that we're in now, stage 2, we've kind of been in stage 2 earlier during the pandemic. What makes your optimism higher this time around that we're in this stage than perhaps last time? I take it the answer has to do a lot with vaccinations, but I just want to get a sense from you. You know, we were optimistic when we went into this stage before. Should we have a higher sense of optimism now based on what we're seeing?
I think we have reason to be optimistic. And yes, I'd say more optimistic because of where we're at with the vaccine. And you saw what the numbers and the percentages are for Peterborough. Those are people who are, when they're fully immunized, they have 90% protection against being infected and almost 100% protection against severe illness and hospitalization and death. So I do think that the big difference here, the game changer, Paul, is the availability of the vaccine. We wouldn't be where we are now without the vaccine. But again, recognizing that the COVID-19 continues to mutate and that the variants can pose risk and harm, and we certainly have more risk of transmission now for people who are not immunized or who have only one dose. So the risks are higher for that small percentage of the population that is not immunized. And if anything, I hope it will compel people who maybe are sitting on the fence to go ahead and get immunized, because without that immunization, they really are at great risk of getting this terrible disease.
And you kind of led into my next question. That was regarding the Delta variant, and that variant is a concern even for those who have been vaccinated. But when we look at the number that are unvaccinated, just over 23% of adults 18 and over locally, that Delta variant becomes an even bigger kind of thing on the horizon for them, does it not?
Yes. So as I said, there is greater risk for people who are unimmunized, and for even people who only have the one dose. The risk of infection from the Delta, if they are exposed, is much greater. And so it is important, I think, to be immunized and to complete the series of immunizations now that the door has opened wide and people can book their second dose as soon as 28 days. They should do that. And we have lots of availability right now, lots of appointments that are open for people to book for that second dose.
So there's no excuse. I'm sorry, I just one more thing, and it kind of closed on a somber note. You mentioned there's been an additional death, and do you have any details again about was this a community member, a male, female, anything you can tell us at all?
Yes, I have a little bit of information, but not much. Unfortunately, I know that it was a woman in her late 70s and that she was a community member. She didn't live in a long-term care home or congregate living setting. And I do know that this individual had received one dose of vaccine as well.
Would this be a case, if you do know this, of that having contracted COVID during that 2-week period after the first dose, or?
That I'm not sure of, Paul. I'm sorry. I don't know I don't have those dates.
Okay, no problem. Thank you so much, Dr. Salvatierra. I appreciate it.
Great. Thank you very much, Paul. Okay, Jessica Niznik from Global News. Great that you could join us today. So if you've got some questions for Dr. Salvatierra, please go ahead.
Thanks, Brittany. Hello, Dr. Salvatierra. Great news about the long-term care homes today. What are your thoughts on the province's decision to allow more visitors?
Well, there's such great uptake of vaccines among long-term care home residents and I think staff as well, that I think this easing of restrictions is really long overdue. It's been so difficult for residents and it's gone on for such a long time. I'm very happy for them, and I'm happy for the families as well to know that they can really have that time with their loved ones again. So it's reason to celebrate, really.
It is. And actually, you're allowed to give a hug now, too. I visited a friend at Fairhaven and I said, I wish we could hug. And they said, you can have a quick hug. So that was lovely. Do you have any idea? I know it's not up to you, but when will seniors in long-term care homes be allowed out again? Like they're fully vaccinated. When is that going to happen?
That's coming soon, Jessica. I know we had the Minister of Long-Term Care meet with us yesterday, all the medical officers of health, and he advised us that they are looking at expanding the absences and allowing residents to go out in the community. So that is being worked on. It'll be definitely the next step. Once these current new changes are made, we can look forward to that coming very soon.
Excellent. Thank you. That's it for me, Dr. Salvatierra.
Okay, thank you, Jessica. Okay, let's hear from Bill Hodgins joining us from Peterborough This Week and mykawartha.com. Go ahead, Bill.
Hi, just one question for Dr. Salvatierra. I've heard of families where they have children that have been vaccinated, but some of their children are just a couple of years too young to be vaccinated. And I'm curious how much more cautious they need to be than other families where their children have been vaccinated.
More cautious from what perspective, Bill? You mean in trying to prevent infection?
Yeah. I'm just thinking them visiting other families, maybe visiting, I don't know, theme parks, whatever this summer. Do they need to be extra cautious?
Well, I think the public health measures that remain in place and the capacity limits, for example, all do assume that not everyone will be immunized. So there will be people who can't be immunized because they have medical exemptions or contraindications. And then there are the ones under 12 who can't be immunized yet, as well as those who've chosen not to. So if as long as the public health measures and the restrictions that are in place are followed, there should be enough protection for those little ones as well. So, you know, for example, right now, I mean, the distance is a big part of the way we're protecting each other is by maintaining that distance, encouraging more activity outdoors where there's better ventilation, and also encouraging that masks be worn outdoors if you can't guarantee that that distance will be maintained, but then definitely indoors in public settings and in, you know, other retail or other settings, face coverings continue to be required. So that should help protect those little ones until we can get them immunized. And I understand that the clinical trials will be reporting in the fall, and we're already starting to have conversations between family doctors, public health, and the province about how are we going to immunize those little ones once the vaccines become authorized for them sometime this fall. So we're thinking ahead.
All right, that's it for me. Thank you.
Okay, great. Thank you, Bill. Okay, Joelle is joining us from Peterborough Examiner. So I'm sure you've got some questions for Dr. Salvaterra, and please go right ahead.
Yeah, I do have a few questions. Thank you very much. Is there any news on more clinics coming in the county soon? I thought you mentioned that last time. I wondered about that.
Yes, there are more clinics coming in the county, and in fact, I'm not sure. Have you gone online, Joelle, and looked for those specifically, or?
No, you might have something fresh today on that I have not seen.
Okay, I'm wondering. I'm going to ask Brittany if you have those dates, Brittany, because I know I don't have them at my fingertips.
We do. I do know the dates for the upcoming clinics in Norwood, which run from July 12th to the 14th. So July 13th, sorry, 12th, 13th, and 14th. I'll have to check to see if there's more county dates, but those are the ones that I'm aware of.
Oh, that's excellent. Okay, and do we have the full complement of pharmacies that'll be offering now? Like, is that, or are there more to come, or what's happening there?
I certainly think we're up to our target. I think the target was 26, and I believe we have 28 pharmacies in the Peterborough area that are now offering vaccine. Whether or not the province is going to push for more to do it, I'm not sure. But right now, sort of the limits of that has been, you know, the pharmacies that in the past delivered the influenza vaccine. Those are the ones that are eligible to do COVID-19 vaccination. So the short answer to your question, Joelle, we're at that limit. We've got them all onboarded and they're all getting vaccine.
Okay, that's good. And the last question I have for Dr. Salvaterra, I have others for others, but I just wondered, are there any reports of serious adverse effects to the AstraZeneca vaccine that do not include blood clotting? Like I've heard about neurological symptoms and other things occurring. Is that something that you're following in Peterborough?
Well, we follow all adverse events following immunization. So I'm just trying to think back, Joelle, as far as what I've seen with AstraZeneca. I can't be specific, but I can assure you that if something occurs within, you know, post immunization period, that we do report that, whether or not we know for certain it was caused by the immunization, unless we have really good reason to believe that it wasn't. So we tend to be very cautious about how we collect and report this data. We tend to be more comprehensive and inclusive in order not to miss anything.
Okay, and the last thing I wanted to know, is it pretty much Alpha and Delta now? Like the first variant is long on, right? That's a year behind us.
Yes, right now it's either Delta or Alpha.
Okay, thank you very, very much.
Okay.
All right. And the other question I had is my perennial question about charges. Just wondering if there were any. It seems like the protests are getting smaller and dwindling. I just want to check in on that. Thanks.
So that sounds like that might be a question for our Peterborough Police Services, and I believe we have Staff Sergeant Dan McLean with us. If you're able to take that question, Dan.
Yes, Brittany, I can take that question. Hi, Joelle, Staff Sergeant McLean here. You're right. The weekly protests in front of City Hall and Confederation Park have dwindled over the last several months. I believe on Saturday there might have been close to a dozen, 10 to 12 people on each side of George Street. So they have really dwindled down. As far as any other charges, I'm not aware of any other charges under the Reopening Ontario Act. But just on a side note, we continue to receive quarantine checks for international travelers that are coming into the country. And I know that those rules may be changing coming July the 5th, but we do continue to do quarantine checks. We actually have an officer in today on overtime, and they are conducting these quarantine checks. We actually have 13 of them to do today. So that continues to be part of our roles and responsibilities.
Oh, thank you. That's a really good detail. I'm really glad to know that. Okay, I think that's about all I had. I'll pass that on to all my colleagues. Thank you.
Okay, wonderful. Thank you very much, Staff Sergeant McLean, and thank you, Joelle, and to all of our media partners. I believe that brings us to an end. And
one thing, Brittany,
oh,
that
go ahead.
I was able to check while I was off camera. Jessica, in response to your question about overnight absences, and I just checked the memo we got from the minister yesterday, and right now the plan is that they will be allowed starting in step 3. So when the province moves to step 3, they are going to enhance that the absence policies in long-term care homes. So I just wanted to let you know that.
Awesome. Thanks so much, Dr. Salvatierra.
Great, thank you all. Okay, wonderful. Well, I think as I mentioned, we've reached the end. Just a quick update before we go that the local COVID tracker will not be updated tomorrow as it is a statutory holiday, but the new numbers will be updated on July 2nd. And we will convene here again for the next COVID situation report on Thursday, July 8th at 12 noon, and we'll proceed with Thursdays at noon going forward. So with that, I wish you all a safe Canada Day, and thank you all for joining us, and do take care. Thank you.
Thanks so much,
Thank you,
Brittany.
everybody.
Thank you.
Thank you.